Hello, my name is Joyce Gibb. Thanks for being with me today. Today I want to talk about some newer innovations in organ transplant. And as we know, they are now doing organ regeneration. Transplant waiting times are typically huge. They can be years. Many people waiting for an organ transplant typically can die before they even, get an organ transplant. But they can use now dead and damaged lungs can now be restored and preserved in good condition for up to 22 hours to be flown with 100% success rate. And I'll talk about something here in Pittsburgh at the end. So another stem cell-based platform is called 3D printed organs, and it's a 20-year-old technology. It is fast advancing from skin and bladders to solid organs like heart, kidneys, and lungs. Projected before the end of the decade will be an unlimited supply of affordable and safe on-demand transplants. They also have humanized, genetically modified pigs that could provide more than enough off-the-shelf organs for everyone on the transplant list, maybe stronger and more resilient than our original organs. Another regeneration platform is rebuilding lungs from scratch by combining a pig collagen scaffold with the recipient's own stem cells, so there is zero chance of rejection. It's a perfect DNA match, and there's no need for the immunosuppressant drugs. What is a scaffold? That's one thing I just mentioned. There's a pig scaffold. A scaffold are synthetic, non-immunogenic, and biocompatible materials. They've been developed and successfully implanted. There's another way they do this. Our lymph nodes can be turned into bioreactors that you kind of think of, with nuclear medicine, to manufacture many organs and support and replace diseased originals. There's on-demand cyborg kidneys. There's synthetic scaffolds. Remember, that's the non-immunogenic, biocompatible, infused with stem cells, and they can regenerate normal urine and are targeted to be human tested by 2023. There is a Dr. Anthony Atala of Wake Forest University, and he's been using stem cells to grow 3D printed bladders for almost 20 years now. People today whose lives have been changed and transformed by him. There's one person that stands out, and this is Martine Rothblatt, and is chairman and CEO and founder of United Therapeutics, or UT. The quality and scope of her thinking gets to a different level than anyone else's. United Therapeutics is changing the game for the multitude of options for life and death organ transplants. She has envisioned a way to connect the whole world with news and music. Like I said, she's an outside-the-box thinker. She's the one that developed satellite radio, or SiriusXM, which our shows are on 131. Next, as a lawyer, she drove the discovery of orphan drugs to save the life of her daughter with an otherwise terminal disease, which is pulmonary hypertension. She's an author, a lawyer, helicopter pilot, and a green revolutionary. So pulmonary hypertension was developed, a drug, Remodulin, REMODULIN. And so it's also, that was an inhaled version, and it was a pill. And then there's another actually pill that was called Orentrum, which is Martine Rose, spelled backwards. And it was actually developed for pulmonary hypertension. So why are lungs so important? As you know, there's a lot of people that have chronic lung disease, or a lot of people are getting pulmonary fibrosis these days, especially even from COVID. But replacement lungs, there's greater than 1 million people have end-stage disease for lung disease. Greater than 100,000 people are on the wait list for transplants, and mainly kidneys and hearts, but many die each year waiting for their name to come up on the transplant list. In 2019, which was a few years ago, but there were 2,714 lung transplants across the country, and the chances of getting a lung was barely 1%. So doing this new technology is going to be huge for a lot of people that are on the waiting list. So when a registered donor dies, the vast majority of lungs are ruled out to be used. because due to infection or degenerative disease. But among the few that make the cut, 80% become filled with mucus and other fluids, and then they're ruined by death from the patient dying with decreased blood flow. So building on the work of a Dr. Khashoggi, a surgeon at Toronto General Hospital in Canada, the UT established the world's first centralized lung restoration facility in Silver Springs, Maryland. So what did they do? They took, and this sounds kind of odd, but this is what they did. They took dead, rejected organs for transplantation because of their poor condition. They pumped in a special solutions to revive them under a glass dome that acts like the artificial body and lasts up to 22 hours. Toxic bacteria and fluids were flushed out. The tears on the lungs were repaired. And then if the organ met the standard eventually for this procedure, they're cold packed and they're flown and transported and are good for 22 hours. So every single person that they had done in this initial study had walked out of the hospital with their new lungs. United Therapeutics is also has a subsidiary, and it's called Lung Bioengineering. And this technique that they're using is called ex vivo lung perfusion, or EVLP. And there's a second branch of this at the Mayo Clinic in Jacksonville, Florida. So this is an example of somebody that's benefited from this. Her name's Heather Leverington. She's a 5-time natural collegiate shot put champion. In 2010, after a bout with lupus, she started needing oxygen. 2 years later, she was on a flight to Spain and she passed out. Her diagnosis then was pulmonary hypertension. And it's kind of like high blood pressure of the lungs. That's what pulmonary hypertension is. She had a very, very aggressive case and it blew through all the medication that potentially was used to treat this. Couldn't slow the disease down. And she was still in her 30s at this time. So about 2016, about 10 years after her lupus bout, she was about to lose hope. Then she received a call from a hospital in Pittsburgh, and it's a UPMC in Pittsburgh. And the UT clinical trial was what they were doing at that time, and she wanted to try the transplant with the EVLP lungs. And remember, ex vivo lung perfusion. They matched the lungs from a 28-year-old, and the 12-hour surgery was a great success. 1 year later, she won the gold medal in shot put at the U.S. Transplant Games. And soon after that, she became pregnant and gave birth to a healthy baby, which usually patients cannot get pregnant when they have pulmonary hypertension. So the EVLP is at the UPMC lung transplant program. The lungs are placed in a clear plastic dome attached to a ventilator and the filtration system. In the dome, there's a steady temperature and it's treated with specialized solution, clearing out the bacteria. So UPMC Lung Transplant Center would recommend looking that up if you know anybody that potentially needs a lung transplant, especially people with pulmonary fibrosis that has happened with COVID and other reasons even prior to COVID. So thought this would be an interesting little topic here to update you on some things that are happening here in the Pittsburgh area. If you want to talk to me about your health problems, anything that I could help you with, I'd be glad to do that. Please call and give us I'll be glad to help you on your health journey. Thanks a lot. Thanks for listening. If you want to make sure you're getting the latest health information, click the subscribe button below and ring the bell. That way you can make sure you're not going to miss out on any of the latest information.